flossed their teeth today? It's okay, you can be honest, I'm not your dentist. Roughly half of us didn't, and roughly half of us suffer from periodontal disease, highlighting a massive global health burden where over 2 billion people worldwide have a moderate to severe form of this disease. Periodontal disease, otherwise known as gum disease, is a chronic condition driven by bacteria that causes the gum to detach from the teeth and bone, forming the periodontal pockets. This leads to bone and tooth loss and a cascade of other health issues, and there's currently no cure. At AdHeal, we're changing that. Our patented tissue adhesive uniquely adheres to wet tissue, targeting the root of the problem, the periodontal pockets. Our minimally invasive therapy fills the pocket, adhering the gum back to the tooth while simultaneously promoting tissue regeneration to close those pockets. This not only halts disease progression, but could even reverse it. We're offering a true solution to a critical unmet need. Our data validates our adhesive's functionality, and we're raising £1.5 million to complete preclinical testing with the goal of achieving CE mark by 2029. Our gums are the gateway to our health. Join us in revolutionizing their care. Thank you.
So I heard you say tissue regeneration, so just for clarification, is this a device or do you think it might be considered a therapeutic? Because when I think of regeneration, I'm thinking a therapeutic, so that's just for clarification. But my question really is, how do you think this will integrate into current standard of treatment workflows, acknowledging that our NHS dentistry system is not world-class?
Yeah, great questions. So first off, this would fall as a Class 2B device in Europe, primarily because it's a biomaterial and the main mode of action is the physical adherence. So by taking the bacteria out of the pocket and physically adhering the gum back to the tooth and bone, we can leverage the body's natural healing system to help with the tissue regeneration. Our material also has the capability to deliver therapeutics, so we're approaching this as a two stages of products. The first one focused on the adherence. The second product would be a combination product to deliver the therapeutic to increase the speed of the tissue regeneration. In terms of how this would integrate into the standard of care, right now, the standard of care for periodontitis is professional cleaning and scaling and root planing, and it only takes the bacteria out of these pockets but does nothing to address the existence of this pocket and its growth. In terms of current regenerative treatments that exist, they are there, but they're for severe cases of periodontitis, and they all require surgical intervention. Our therapy, we're designing it so it could essentially be applied in the dentist's clinic. So essentially, the scaling, root planing would be done, bacteria would be taken out, we would fill the pocket at that point. In terms of how the NHS would adopt it, we're targeting public systems because periodontitis is a massive health burden costing the system billions of dollars. By intervening early, we can save them a lot of money in the long term. We also have a clinician on our team who's a key opinion leader in this space, so we're working heavily with clinicians to improve adoption, but definitely changing the care pathway is always a challenge.
You've already answered some of my questions, but another one, it's actually a really fragmented market, so I guess, public is hard, so you would go private, target private at some point, really fragmented. How would you go about it? And have you already engaged with other clinicians other than the one on your team to understand adoptions, barriers?
Yeah, great question. Definitely a very fragmented market. Have been working on trying to understand it better. As you mentioned, public is difficult in terms of the procurement system, so we will be targeting private. We have engaged with clinicians. There is interest in this, especially from the perspective of preventing patients from getting to the severe form of the disease, and due to all the additional health risks that periodontitis has, it's been linked to a lot of other systemic diseases. We need to continue in the engagement because it is fragmented. We aim to work with distributors and dental key opinion leaders to help with that adoption, but I think it's definitely an ongoing process. Thank you.